Hello everyone. Welcome to our educational chiropractic care series. Today, we will discuss chiropractic leg adjustment massage, a professional technique used to improve joint mobility, muscle balance, and lower body alignment. This video is for educational purposes only and is not a substitute for professional medical advice. Section 1. Why leg adjustment is important. 0-20 to 110. The legs play a crucial role in posture, movement, and overall body stability. Poor posture, prolonged sitting, repetitive movements, or physical stress can lead to muscle tightness in the hips and thighs, restricted knee movement, reduced ankle flexibility. Chiropractic leg adjustment focuses on restoring proper biomechanics and improving functional movement. Section 2. Assessment before adjustment. 1:10 to 2 o'clock. Before performing any adjustment, the chiropractor conducts a thorough assessment, including visual posture evaluation, leg length comparison, hip, knee, and ankle mobility testing. This step ensures the technique is safe, controlled, and customized for the individual. Section 3. Muscle preparation through massage. Prior to adjustment, a soft tissue massage is applied to prepare the muscles, relaxing the quadriceps, reducing tension in the hamstrings, improving circulation in the calf muscles. This preparation allows the joints to move more freely and reduces discomfort during adjustment. Section 4. Chiropractic leg adjustment technique. 3:10 to 4:30. The chiropractor then performs a gentle and precise leg adjustment, which may include controlled hip joint mobilization, knee alignment correction, ankle joint mobility enhancement. These adjustments are performed with minimal force, respecting the natural range of motion. A mild popping sound may occur, which is a normal release of joint pressure. Section 5. Benefits and aftercare. Potential benefits of chiropractic leg adjustment include improved walking mechanics, reduced lower body stiffness, enhanced balance and coordination. Aftercare recommendations may include light stretching, proper hydration, and avoiding strenuous activity for a short outro. If you are considering chiropractic care, always consult a licensed and qualified professional. Thank you for watching this educational video. Please like, share, and subscribe for more evidence-based chiropractic and wellness content.